I'm Dinah Foster. I'm an oncology certified clinical social worker at UT Southwestern Simmons Cancer Center. Today we're talking with a caregiver about how sometimes that role can be difficult and the importance of taking care of yourself and what support resources are available to caregivers at UT Southwestern Simmons Cancer Center. So how did you first find out about caregiver counseling at the Cancer Center?
Through my husband's medical team, who was very helpful with many resources that were available to us, and I'm grateful for all of those.
And regarding the caregiver support group, why was that something that you were interested in?
The beginning of diagnosis is overwhelming, and it can be frightening, and you don't even know where to turn. Being around others who are traveling a similar journey is important to me.
One of the unique things about Simmons Cancer Center is that patients and caregivers have the option for one-on-one counseling as well as a support group. I think they both have value, and that way they get to choose what feels best for them at their particular situation and experience.
Not everybody feels comfortable speaking in a group setting, and they prefer being one-on-one, and yet there's others who want to be in a group setting and hear other people's stories. There's some people who are afraid to share their story because it's so overwhelming and they don't know how to maneuver it.
So there will be some caregivers watching this video. If you could speak to them, what would you share with them in terms of your experience as a caregiver with your husband?
I think it's important for people to know that it's okay to be tired. It's okay to be sad some days. It's okay to not even know the next thing to do. And yet, I also learned that it's important for you to take care of yourself, because you can't be an excellent caregiver if you're not taking care of your own body and needs. It's very important to drink water all the time, every day. That's very important.
It is so important that we remember to take care of ourselves because it's a stressful time. When you're taking care of someone, that's a big responsibility.
It was very important for us to be together pretty much 24/7, and that's how we handled our journey. We asked each other questions, and some of them were very challenging questions. Some of them were funny. Some of them were things that we never thought we would be asking each other. Since my husband was not able to sleep in bed comfortably anymore, he slept in his recliner in the den. I slept on the sofa next to him. So we called it a slumber party. And we had a slumber party every night for 10 months.
What did you do during this time as your role as a caregiver for your husband that brought you joy or brought you meaning during this time?
One of the things that brought me joy is that I love to bake, and it brought normalcy to my life, and my husband enjoyed it as well. And oftentimes friends would come over and they would be in conversation with Dwayne. So that gave me the opportunity to go into my office and pay bills and take care of things that needed to be done. Another source of normalcy in our life was we loved and spent a lot of time in our pool in the backyard, along with our dog, Ava. It made him happy to know that Ava and I were happy.
What would you tell other caregivers about your experience?
I think it's important for caregivers to learn how to move forward in life, not move on, because that person's always going to be a part of your story in your life. And to find joy and happiness each day.
Do you feel like in creating that sense of normalcy helped you feel a sense of being in the here and now or a level of acceptance?
At the beginning of the diagnosis, there was many emotions going on within myself, and then trying to think about what my husband was dealing with. There were several emotions I personally had to go through in order to reach that level of acceptance it became apparent to me that I needed to be accepting of the situation, which is not always the most comfortable place to be. And yet it helped us on our journey on a daily basis.
Thank you so much for your time today and sharing your story and your experience with me. I love hearing about you and your spouse and what this experience was like for you.
Dinah, thank you very much for allowing me to share my story with you today. And I think moving forward, this will also help other caregivers as they experience their own journeys.